How are you doing today, Chris?
How's it going?
It's
I'm
going excellent. I love that background. You've got like my dream background scape. I don't know the place that has that combination of fireplace and beachfront,
yeah, I don't
but
think
it just seems like it may.
probably I don't know if it's real or CG, so hopefully that'd be nice, right?
Yeah, like where you have like the I guess it's the Hamptons, right? Like you have a certain level of cold and then you walk out. Well, I guess, maybe some parts of California too, I guess are like that too. So
Yeah. Well, everybody
yeah.
tells me it's like oh, I'm too close to the beach. I'd have to keep cleaning up after it, right? Because it's just like
Yeah, that's true, right? That's like that becomes like your backyard, right? Like you're not clean your backyard up, Chris. Come on.
exactly. I just have to keep raking back there. It'd be like my own personal giant Zen garden. It's like
Exactly. Well, it's a pleasure to meet you, Chris.
that was
Absolutely.
great to meet you as well. I mean, I was looking at your the little note you had here about that's a great. I love that. I love that phrase. Distance dinosaurs and damn do-gooders.
Yeah. um, it is a ode to my reflections on my career to date and kind of what I've seen in the over the life cycle of trying to just create solutions.
Mhm.
Um, you'll find yourself working with a lot of success hounds, but
Yeah.
you find very few solution hounds.
hmm hmm Exactly.
Yeah.
Exactly. Well, so that's an interesting. So, what do you define as success? Well, maybe let's step back a bit. Usually, I go, "Hey, why don't you tell me a little bit about yourself?" And just jump right in. I'm fine with that. We could work it like a novel. We could do the exciting stuff up front, then we'll do the the backstory later.
However you want to do it. This is like my favorite topic to discuss, which is the future. And so because I think one of the most limiting things, unfortunately, and I was trained in behavior, right? And so behaviorists believe that the greatest predictor of the future is your past behavior. And there was obviously, reams of literature that support that, and I don't disagree. But I believe personally that for futurists, people who are committed to charting a new path and a new direction that the greatest predictor of future is how much time you spend thinking about the future. And that's what sets them apart from the reams of people who move lockstep with that theory of, the greatest predictor of your future behavior is your past behavior. That's what makes the futurist and the traditional individual different. And so I try to spend, if there's 24 hours in a day, I try to spend 23 and a half thinking and focusing and being committed to charting a different future for the things that I encounter in the world. And I just think that's needed. So, reading your website and hearing more about you, I'm hoping that, I'm glad to do this, but I'm hoping that we can become friends and colleagues and remain connected towards the future so that I have yet another compadre to talk about the thing that I'm so committed to.
Absolutely, that sounds great. Well, no, I'm totally in agreement with you because it's kind of like people think that the future and the past are connected when in reality they aren't. They're completely different realities, right? I mean,
Mhm.
you have the reality that you went through to get to this point, and then there's a completely new reality coming up in front of you. And you can use the past to design your new reality or your future, but it doesn't necessarily need to be so. I mean, it's only people who are living in the past who say, "Oh, I want to repeat this, I want to repeat that," who make these things happen again. But if you spend time thinking about the future, you can absolutely create and design a whole new reality for yourself, even if
Exactly.
whatever happened in the past happened in the past.
It is connected to as much as the past is the previous future. That's as much as it's connected. It is the previous future, and that's what I try, to tell students, colleagues, whomever, that if you look at the past as future, the previous future, then you'll look at it as solely a opportunity to learn the process of charting a new future. That's it, but not the content, just the process. So how did those people 100 years ago think about the future?
Yeah.
And use that. But I don't really care, so much about what the outcome was and what the product was of that thinking, as much as I care about the process that they used to chart it.
Yeah, absolutely. And do you find, but they find that the process used also changes too.
True, true, very much so. And it changes based on the context of where you are, the environment and where you are, the people who are around you. All those things change, and so you have to change with it. But I think, there are some universal laws. Your ability to overcome your context is I think, and learning how people did it. The thing that I always found funny, like Benjamin Banneker, right? So Benjamin Banneker invents, the precursor to the traffic light, right? So here you have a black man who can't even really own or drive a car at the time, thinking about something that, in essence, he will never himself benefit from or realize as a benefit for himself, but still creates it. Now think about that. Like that to me is hallmark to a futurist, right? Like, void of all those other things, I could care less, but that is the future. And so I have to create it because that's just who I am. Mm-hmm. And there are many things that, I think in my time and career, I have witnessed that have been that way. People with 99-year land leases and 99-year development plans. And I'm like, why would you design a 99-year development plan? And they're like, because that's the future. What am I going to do? And so I just think that's just brilliant. But it's also a certain level of altruism that never gets credit.
Oh yeah, absolutely. I mean, I think the best inventors are the ones who, they don't look at it for the money. They don't look at it for money at all. They just say, mm-hmm. Here's a problem. And usually it's something that is their problem, right? It's a problem that they have. And then they apply their brains to it and they go, well, I want to solve this problem. And they don't care about what comes out of it. They just want to create a thing, and they just hope, I mean, if they can build it themselves, they can. But if it just gets built and becomes something new. That's why I like Elon Musk so much. He's like the Hyperloop. He just goes, here's the thing, I can't build it, so somebody else try. I mean, and I think that's the best kind of inventor, who's like constantly creating solutions, and then just whether they can do them or not, just put them out there and see what would happen. Because it just,
so therein lies the distinction between success and solution, right? So a successful person only does things to the extent that it is self-rewarding or self-aggrandizing, right? And so if they will not themselves reap success from it, then it's not worth their time. Those individuals who are solution-oriented could care less about the credit. They are in it for the solution. And that is their ultimate reward. And so, like you said, so appropriately, it's not about the money or any of those things. And in some cases, some rare cases, those individuals end up going on to be, enormously wealthy or successful. And even then, you reap even more benefit because they use their wealth to further improve and create more solutions. In the case of Elon Musk, whatever people may think about him or whatever, he I think has created a tremendous thought infrastructure, and that I think will yield benefit for society for eons to come.
Yeah, absolutely. Well, I mean, anybody can do it. I think that the key thing is, how do you actually get this invention out there? I mean, we can all postulate different futures and solutions for those futures, but a lot of times they're just hidden, right? They're just like, how do they actually get out there so that they can be executable in some way? And how do you spread that to the masses? I think that's the most difficult part now. It's kind of like anything else. It's like, it used to be, oh, if you build it, they will come. And now it's like, if you build it, they won't come until you scream about it.
Right. Well, when I started in academia, I tell my colleagues this all the time, my junior colleagues, that when I started in academia, the goal was to be the most rigorous and the most accurate. Today, I have to be the most popular. It is not enough for me to be the most rigorous and the most accurate. I must simultaneously be the most popular, because the most popular science is the one that is heard, not the most accurate or rigorous. And so that has changed the game in how we do things. And in fairness, some of that has to do with the delivery of knowledge and the speed at which knowledge can be translated from the scientific method to marketing and communications, right? So I literally can have, it used to be that you had to have a grand announcement and it had to be done by some third party who, CDC, NIH, whomever, to announce your work. Well, now, we could literally walk to the green room down the hallway, convene a press conference by, Twitter or Instagram, and tag NIH and CDC in it, and we're off to the races. And I can make the case also that my institution would be mad at me if CDC or NIH announced it and they didn't, because it would ruin their click-through for their own website. And so these are the things you have to know today that you didn't have to know when I first started my career. And I think there's a greater autonomy for researchers now than ever before, right? I'm hoping that, and I talk about this a lot now with my junior colleagues, is that they should all be thinking about creating their own research corporation. It's really no plus anymore to writing a grant at an institution and giving them 50% of your grant when you can house that on your own, many times from your bedroom. And so, I think we're going to see that. I think also, and this has been controversial, but I continue to say it, I do believe that we're moving in a direction where research will be vetted more from a Yelp concept than this peer review thing. And people hate me saying that, but we already kind of Yelp research. I can do the greatest research in the world, but there's a handful of people in my space that have to sign off on it and repeat it or cite it, right? Which is basically, right? Citing is basically the previous century likes and shares, right? I mean, come on, let's just call it what it is, right? That's the dinosaur. And so I talk about dinosaurs. There's the dinosaur. Yeah. The dinosaur way of likes and shares was citing, right? And so now, if no one ever cites my article, but a handful of these very prominent, well-respected scientists share my research on their Twitter, I guarantee you, if 1,000 citations will never equate ever to even 3 high-impact researchers sharing it or liking it. And I can monetize the latter and not the former. And so that's why I think we're moving in a direction where research and what we call science will be a world of likes and shares like everything else. And are we ready for that? Are scientific journals ready for that? Are academicians and how they're trained ready for that? Are they ready? So, most things that get hacked due to arrogance. And there is no infrastructure more arrogant than the academic ivory tower.
Yeah, absolutely. Well, I mean, the question I have there is, I've heard this said before where people say, well, it has to be cited by, specific individuals because they're the ones who have import, they have power, right?
Yeah.
But nowadays, if it's crowdsourced and you get people from all over the world saying, sharing and liking and whatever, then does that diminish the power between the people who are like these specific individuals who say, I have to bless this, or if enough people from all over the world say, listen, this thing is important, we need to talk about it, and they don't necessarily need to be that credentialed. I mean, do you think that makes it as important or less important?
I think you're going to see, I think science needs to now be viewed as every research project, every scientific endeavor is a startup. If you look at it from that standpoint, then your question becomes very clear cut, right? Anyone who's been in entrepreneurial ventures and startups recognize that, yes, you're going to have a handful of VCs who are going to ask you to demonstrate proof of concept, blah, 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 blah. But then there's a group of VCs who take the word of another VC or take the word of the buzz on the street, right? You could have no articles about your product, but because you were announced at some major conference and everyone's talking about you on Twitter and Insta, they're ready to open their pockets for you. And so I think you're going to see the same thing when it comes to science, right? You're going to have, I mean, we're seeing it with the, with coronavirus, right? I mean, there's a, no disrespect to the pharmaceutical industry and what they're ambitioning to do, but we have no way of knowing the rigor that is taking place with these vaccines and whatever. We're just being told through popular media that, hey, we got a vaccine, and those in the know have to explain to me how all of a sudden we were able to create a vaccine in 12 months when in the previous centuries, we've had to spend enormous amounts of time to do the same thing. And so we are at a exciting time in the transfer of what was known and what is accepted, and I just think that that's just so cool, because I think it offers a great opportunity for equity, voices that were never heard. People in the local state university who do great work can finally be heard, or the young person who lives in some inner city who has now access to an incubator at some Fortune 5 tech company, can now not only launch a business, but have it capitalized and run it, and have a team of very highly skilled individuals support them virtually in doing it. To your point about global, I can launch a venture here, and I can have some expert in Morocco who is helping me day to day on it, and probably leapfrog development stages that I never could have in the previous model of waiting for someone to get involved more in an offline orientation. And so, yeah, I think it's just really cool. It's really cool. But this kind of leads to the thing that I wanted to talk about today, which is trust, right? Because trust is undermining a lot of our, not undermining, is limiting a lot of our ability to truly move at warp speed in these in this innovation space and in this future model, because we have done so much damage as a society in being equitable, fair, and transparent with so many populations, that when we need them most to trust us, we have not a leg to stand on. And this is probably the most trust needy environment that you could ever live in.
Yep.
Right? I mean, you got to get in, you want transportation, you got to get in a stranger's car. You want you want information, you got to, you want your news, you got to trust, one of a billion podcasts or whatever. You got to trust, right? And so that's why I believe the two fastest growing industries that rarely get talked about are going to be ethics and the humanities, right? And they will in some ways become the aligned industries with science that will help it propel to the lengths that it needs to propel to.
Yep. Yeah, you're right. I mean, I've always said that companies need a chief philosophy officer who can do that in
Absolutely.
technical pieces. And I think you're absolutely right about the trust thing, is that we're asking a lot of people to trust with no data, right? So we almost need a whole trust infrastructure in place to say, you know, this guy this is a good person, you know, you can trust him, et cetera. It's almost like eBay listings, right? When I post something on eBay and people keep buying stuff from me, I have a star rating, right? So if everybody had their own trust rating, then it would be easier for the next person to come along and say, oh, this guy has had trustworthy dealings with these 1,000 people. He's probably going to be trustworthy with me as well. But I want to go back to one thing that you mentioned earlier. So I was thinking about disruption in academia, right? So you've got all these credentialed people who are making decisions, but then that whole thing needs to be disrupted by the crowdsourcing and the quantification numbers as opposed to the qualifications. So what does that do to higher education? I mean, does that mean higher education is also something that we need to disrupt?
So I think higher education is already being disrupted. I just think that we have such a enormous investment in the status quo that, so I'm gonna use healthcare as an example, right? So your typical electronic health record, a health system is investing billions with a B to install and implement and launch these electronic health records. And there's a handful of them. There's not a lot of them, less than 10 that the country is using. No one ever stopped to think to themselves, what happens if these guys got it wrong? Right? If they got it wrong, we're so in the hole to them that we can't change. Or change will be so financially disabling that we really can't afford ourselves. So I transpose that onto academia, into higher education. We have put so much money into that system that making change is close to impossible without creating a whole brand new institution. You know, I jokingly say sometimes that Harvard and Yale and Brown should be thinking about a new Coke model, like new Harvard, new Yale, new Brown, right? That's built right next door. And it's half the buildings and half the faculty than your regular Harvard and your regular Yale, right? Because they know that they're doing the most inefficient model of themselves. They don't want people to say it because they have enormous amounts of money that are pumping into that place.
Yeah.
But I think
money pumping too. I mean, they don't want to stop. They don't want to stop.
Yeah. But the halfway intelligent individual knows, come on, you could build the new Harvard right next door for half the buildings and half the faculty.
Yeah, absolutely.
And probably make more money, to be honest with you. But anyway, that is the reality that many institutions are facing, and there is this chasm between those elite Ivies and the rest of the group, where they're fighting to define their ROI, and it's not looking good. It's not looking good at all. And in the world of COVID, it's not looking good for anybody. Think about this. So what is the number one thing that universities do to sell themselves? They offer tours and open houses. Why do they do that? Because they want you to see the great dorms and the student experience and whatever. Well, COVID has taught us that, well, you could operate that without the student experience and the buildings and the fancy stadiums and whatever, right? So now, as we're seeing, right, not just with colleges, but elite private schools, high schools and middle schools and whatever, people are saying, well, my kid's still getting a quality education to some extent, those who are doing it right.
Yeah.
And they're not using that greenhouse,
giant 12-story sports complex.
Exactly. Somehow, some way, they're still getting it, right? And And by the way, do I get a discount because I'm not using it? And that is disrupting the model. And we're never coming back from that, right? Because now people are going to look at that state school that doesn't have, you know, all those fancy accoutrements and say to themselves, you know, can I still get a good bargain here?
Yeah.
And I think the answer is going to be a resounding yes to some extent. I do believe that, you know, there's enough smart people and enough business people to help the Ivies still make a case with the online version. And I think that you know, will resolve itself because there's just too many stakeholders and benefactors in that to lose. Yeah. But I think also we're going to see some really exciting alternative models. You know, it used to be a stuffiness about going to DeVry online, or you know, somebody's not there anymore. Just, you know, really not. I mean, just not there. I tell people all the time, I don't remember the last time somebody asked me where I got trained. Right? I reached a point in my career where all they really care about is what I've done. They could care less where I trained. And I'm going to say maybe 5 years out of school that happened. So if 5 years out, the legacy of my dollars, you know, it's almost like driving a car off the lot. Yeah. You know, like the value of that place I just spent a bunch of money on is depreciated as soon as I walked off the campus, and it's going down, down, down. Yeah. So, you know, maybe I should get the Hyundai. Yeah. You know.
Well, I find that it's the hiring managers who have the problem with it, right? Most of the hiring, it's like, oh, I'm a Stanford grad. I'm only gonna hire Stanford grads. It's like, you don't need to. You don't. It's not necessary. And I think it's going to take almost like a generation of people to say, you know, we don't necessarily need, you know, this one at this high level of education for this role. We're still seeing that happen but then I think you pose an interesting point, is going to Yale or Harvard or Brown, is it just branding? Are you getting the same quality level of education that you'd be getting if you went anywhere else?
Well, so here's my proposition, and we're already seeing this. I believe that the space that the Yales, the Browns will move in is everyone who goes there goes free. So once you do that, everything I just told you is eliminated in the discussion. So I believe that that's how they're going to get you. So they're going to say, look, you come here, you don't pay a dime. We reward you for, you know, your achievement, and we'll get somebody else to pay the tab, but you just be the best, and we'll monetize you on the other side, right? Somebody will, you know, we'll have, you know, preferential placements or whatever, and that's how we'll monetize it on the back end, right? And so whereas right now you get out of school and there is, you know, a plethora of places and things you can do, you might end up now going there and signing some 10-year commitment to some corporation. It's going to be an elite corporation, but you still do that commitment, right? And we're seeing this in medicine. You know, they had the big announcement of NYU's medical school, and everyone goes free there. Kaiser Permanente opened a medical school. There's a privatized kind of model to it. And so now Kaiser will have the ability to have you come to their medical school, go to their residency program, and then go work for them. Yeah. Seems like a lovely deal, right?
The day that Stanford has so much money that they could let everybody in for free, and you wouldn't feel it. They wouldn't even feel it. And it's probably the same. Endowments for all these other institutions are the same.
Yeah, right? and so I think that's the model. They're going to delay it as much as humanly possible, build their coffers as much as possible. But I think that's really where it's all going to hit the road, is that they'll be elite in their ability to mobilize, because they're going to sell it as altruism. You know that. Oh, you know, it's criminal what these kids are paying in student loans, blah, 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 blah. And they're going to frame it like that, and then they're going to get these kids to come there and do whatever. And that will immediately cream the population of students that are out there. it will put the other institutions at a disadvantage. You'll see some consolidation, and so one thing I've found myself not investing in from a future standpoint is thinking that I can own the inadvertent positives and negatives associated with the innovations that will arrive in the future. That one, I don't feel comfortable even beginning to do that because I've seen so many horror stories. So it may be that turns out to be a wonderful thing for everyone involved, but I do know it does hopefully attack one major issue we're dealing with, both in most industries, right? We only talk about it for the ones who are struggling, and that is student debt. Student debt is hurting us societally, not just in what it's doing to the young person's ability to buy a home and start a life, but it's hurting our medical professionals and the amount of debt that we see our medical students carrying, and it's killing our social service sector because you preferentially don't get the best because they have to work in industries that will allow them to pay back their loans. And so it's crippling us from many different directions. But I have to always remind myself that America is still the grandchild of the world, and so we're a little slower to come to the realities about how some of these things have been addressed elsewhere.
Yeah. Well, how do you feel that? What do you feel needs to change about that kind of education, the medical education that they're getting today? I mean, is it just give it to them for free, or is there a way of delivering it in a way that's less expensive? So
it's interesting you say that, right? So I'm in Vegas right now to answer just that question, right? So this is my third health professional school startup, right? I don't know if you knew that or not, but
you didn't tell me.
yeah, I'm sorry. So this is my third health professional school startup, right? The first one was a school of public health in Miami. The second was a new medical school, first of the new millennial schools, medical schools in Miami. And now I'm out here at Roseman University doing a new medical school as well. The commonality across all those, and the reason they recruit me is because of my interest in it, and I guess to the extent expertise in being able to reduce the distance between those institutions and the communities that they serve. And so that'd be the first thing that I would tell you. So, I know you mentioned, my 3Ds or whatever, but they really are true, right? The distance that exists between healthcare providers and their patients is enormous.
Yeah.
You have to keep in mind who is the typical medical student. The typical medical student is the sons and daughters of doctors. And so it truly is a family business. And so as such, you have wealthy sons and daughters going into a field. They usually come from communities and where they have limited to no interaction with people who are less fortunate or have even a middle class background. And so, so you already have distance created based off that, just off of their own life or lived experiences. Then there's the distance geographically. We set up a program where we train medical students by requiring all of our medical students to perform home visits to low-income families. And they do this in teams that include, nursing students and law students and social work students. And so this new way of training is to, once again, reduce the distance between the person who is the provider and the person who is the patient consumer. And you may ask yourself, well, what's the big deal there? Well, the big deal is twofold. One, like no other field, trying to address a person's illness requires that you have an understanding of that person at a level that is above and beyond the typical client salesperson relationship. And just honestly, the only thing most doctors know currently about you is what they can glean from that exhausting registration paperwork they give you when you arrive, and whatever questions they can ask you in 15 minutes, right?
Yeah.
And so, you know, I think all of us know that there's no way in the world that we could shoot. Do you understand that the average patient-doctor interaction is just shy of the amount of time that you have at a drive-through?
You're kidding.
Right? If you think about, like, you know, you stop at the first one, you place your order, you wait maybe 5 minutes, you get to the next window, you pay, you wait another 5 minutes. That's 10 minutes right there. 15 minutes is the target time span for a patient interaction. So think about that. Your doctor is achieving something with you in an approximate amount of time that it would take you to get your burger and fries. You should worry about that, right? And yeah, you should worry about that, right?
Crazy.
But here's another thing that we as society should worry about, and this goes to the other thing I was talking about, is so we ask physicians to train in hospitals, oftentimes the public hospital, and so they go to the public hospital and they provide care to these individuals, and in exchange they learn their craft. And then as a society, we find it acceptable for that same doctor who trained on that poor person in that public hospital to then have the option of accepting Medicaid, the insurance that covers poor people. So that means that I now can profit off of you with no mandate or requirement to give back to you when I now make a bunch of money. That to me is criminal. It is unethical. And so that's the thing that we're raging against in the work that we're doing here out in Las Vegas, is that reality, and showing that you can still do the right thing and still achieve your levels of prosperity that you seek to achieve. Yeah, you may, instead of getting, you know, the Porsche, you know, with the fully custom seats, you might have to bear and gruff it with the factory seats for a little while, and until that time when you make a little more money. And so that's sort of what we're doing. But the other part is that we're really heavy on technology. I spent about 7 to 10 years in Miami working on a platform that will help physicians to, in a glance view, be able to see the social condition of a patient. And it's user-driven. It's user-driven data, and so the platform is called Humble, HMBL, and you can kind of learn more about it by going to hmbl.com, hmbl.health.com, and so that's going to be powering my work out here. We're going to be arming our medical group out here with that tool, along with so that company that I had, Humble, with the dean here at the college, our new dean, Dr. Joe Greer, has recently been purchased by another company called Synnova Health. And Synnova Health is doing groundbreaking work around a new electronic health record system. And so it's the goal to have these two things joined together to finally offer a platform system that will guide workflows that are more patient-centered than what we're currently doing. And you know this from any technology, right? If you really want to promote change, you really have to give people tools for change. You can't just say, hey, I'd really like to see you do this thing, and not give them a tool to do it. If you want people to blend food faster, get them a blender that blends food faster. And
That's
so
right.
if we want people to take in consideration people's social issues and what's going on with their family and what's going on with the quality of the household they live in, then you have to give people the tools to collect that information, see that information, and then workflows embedded in it that can do something about it. And that's what the Humble product does and allows health systems to do. And so there's a lot of excitement about being able to launch that out here. We're going to launch it as part of what an initiative we're calling Genesis. And so Genesis is not about creating a new beginning for Las Vegas. Genesis is about restoring the idealism within individuals. You know, all of us went into our chosen profession for a reason. There was some passion, something burning in us that said, you know, I love this, right? And sadly, in many cases, as time goes on, not the industry, not the path itself, but the industry beats that out of you slowly over time. And the most effective way it does that is it eliminates your options for expressing your idealism.
Yep.
Right? You're like, oh, well, there's nowhere else I can go, so I guess I just got to deal with this, right?
Yeah. Yeah.
What Genesis is about, what Genesis is about is giving that young medical student, that young physician, that young healthcare system, the opportunity to look over and say, oh, wow, that group over there is doing the thing that I got into this industry for. So it's a new beginning for individuals in returning to their idealism. And so that's what Genesis is about. And so we're hoping to offer that out here. It'll train medical students a different way. It'll offer health systems out here a new way to deliver care. And it'll give us a new way of looking at the way that we organize communities. And so we're going to create this thing called the Genesis Zone. And that Genesis Zone will enable us to look at high-risk, low-income households in a given area, offer them a free, accessible Wi-Fi mesh system. So eliminating the digital divide by just basically blanketing that area with Wi-Fi. And then we're looking at some of the other things that are, you know, there's a Go-Ed project out here. I don't know if you're familiar with that, but the autonomous vehicles, using autonomous vehicles in health districts. So we're going to look to leverage those hopefully as well, but use them for food delivery, use them for pharmaceutical prescription delivery. Yeah, and so those are the things that we're ambitioning to do out here that will chart a new future in the way that we look at healthy communities and medical school training. And imagine imagine sending your son and daughter out to something like that, where everything they walk, live, and breathe is about helping individuals. What would that produce on the back end by way of the doctor of the future? And that's what we're trying to do out here.
Fantastic. And that's actually, that's the education. The education comes from the experiencing of how to do those things. So there may be some training involved, but the education comes through the experiencing too. And I want to step back a little bit to what you were saying about so you said Genesis, does it actually connect people with their passion, or does it allow them to create their own on the system?
So I think the whole concept of incubators and accelerators had the right spirit, right? Give people an open, free space to create and watch them blossom. I think we're a little different in this, not to say that we're an incubator or accelerator, we are a medical school, but if you draw upon that concept, imagine that concept whereby everyone who was there to solve one central core problem or challenge. And so in our case, that challenge is, what are we going to do to increase equity across the spectrum of complementary fields related to healthcare? How are we going to have greater equity in the percentages of minorities who are healthcare professionals and providers? How are we going to have greater equity in the quality and access of healthcare for all populations? How are we going to have greater equity and transparency as it relates to the way that individuals participate in clinical trials, the drugs that ultimately are used on them and used and studied using them? All of those things will be baked into what we do. One of the things that I tell people that we ambition to do out here is we ambition to be the most prepared institution to provide services and care to the most high-risk patients in the country. That's the ambition, period. And so that what that means is that every faculty member on our faculty here will be required to do home visits. Even if you're a basic scientist, you could be a guy who just does bench research. You will have to go out to a household and you will have to demonstrate a way of providing benefit to that household. It might be that you explain to them the importance of participating in clinical trials and what that means. And if you have to create new skills and new understandings to do that, that's what it takes to come to work with us, because that's our ultimate goal. And that does not discredit the other institutions that have a different focus. But I think, like any industry, we have all benefited from people who have carved out a niche of expertise and drilled down into it. This is the niche we chose.
Well, I love this model. It's really, really cool. And I can see how it would expand into future things that you possibly do. And since we only take up about 7 minutes left, so tell me about the future. Where do you see yourself and your institutions in 10 years? Do you see a huge difference, similar, or where do you see yourself in 10 years?
So in 10 years, I see us working with somewhere in the neighborhood of 3,000 to 5,000 low-income, high-risk households at any given time, all the time. And somewhere in the neighborhood of about 20 to 25,000 patients in this approach, going to their homes, integrating telemedicine, integrating a concept I call telehome, which is tele-outreach made easy, integrating social service virtually, making follow-up and referral more accountable by having individuals, whether it through wearables or some other mechanism, our Wi-Fi mesh system, us knowing exactly where what people are utilizing and the impact that it has, not the outcome, the impact. So what that you sent somebody to a food bank? Did it solve the issue? Did it create a solution related to food insecurity for that individual and their household members? I see us charting a new way of looking at technology and its ability to truly create impactful change in the healthcare space by broadening the definition of what we view health to be more than just physiologic metrics. It will be new healthcare in 10 years as we define it, as we create it with the future out here, will be about the measures of resilience and prosperity. Those will be the true new health outcomes in my 10 years. And so when a person asks me, are they healthy, right? I will say, yeah, they are prospering and they are resilient to challenges that might occur in their life. And if we can do that, then that's monumental. We have no investment in making people better at being poor. None at all. It's about creating resilient, prosperous individuals. And if we can do that, then we don't have this thing where we give millions of dollars to poor communities and people come back later, 10 years later, 30 years later, and see still a poor community that with no vitality and no return on the investment that we made to it.
Yeah, no, I love that, because I think this is the same problem that a lot of companies have, is that they say that this is what they are. They're like a bank, or they're a financial services, or they're a doctor, or they're a lawyer, or whatever, but they don't look at the holistic view of what their customer really wants. What do they really need in order to get to that endpoint of a successfully realized person? And they just don't step out of their bounds. So you see in medical school, all they do is they teach them how to teach medicine, not how to teach how to improve people's lives in general. And it sounds like that's what you guys are doing, is that
charting the future is not about giving people what you have. It's about giving people what they need. And what we're talking about with this medical school is about giving the medical student, future doctor, what they will need, not what medical schools have to offer. And so that to me is exciting. Layer over it, the innovation and technology space that I find myself very active in. I just, I'm hoping, in 10 years that people are coming out here and they're going to the Genesis zone and they're like, hey, how do I get a zone where I am? How do I leverage what you're doing where we are? And we become the governors of the data for zones all over the world. We are working not to be the headquarters of it, but to be a participant in a network of communities that have these ambitions, and we all collectively create solutions that can be shared amongst our network and make helping people cool again. And that's at the core. I can talk about all the other fancy things that academicians do, but at the end of the day, I was formerly trained in public health, and I always tell people that it shouldn't be called public health anymore because they don't do anything in public. They're never in the community. And so, so they need to find a new word like office health, because that's where I see all of the public health practitioners is in the office, all the epidemiologists and et cetera. But, COVID exposed that. When we needed to be out on the street helping people, we had no infrastructure that understood what people were experiencing, that could connect rapidly to individuals and families who are hurting. And so I hope that what we do in 10 years will be the preferential one that people call and say, hey, we need to do something. Can we dispatch some Genesis teams in our city to do this, to get on the ground and do what we have to do? And we'll have the platform, the mobile technology platform to do it. We'll have the staff all over the country, because our graduates will be all over the country, who can facilitate that and help America in this area of expertise that's lacking. And that's our goal. That's the ambition.
No, I love it. I love it. So we definitely have to keep talking, because I have, unfortunately, I can't do it today, but we definitely have to have some more conversations, because some of the stuff that you talked about, I made some notes, and we should definitely have you back on the show again. This is great. So
why don't we do this, Chris? So I'm building this. So it takes a long time to build a med school, just so you know. We won't even open our doors till 2024. So why don't we commit to a once a year check-in on the progress in building this medical school?
Sounds fantastic. That's great.
I love it.
Tell us, how do you tell everybody how to get in touch with you? Do you have a website, or what's the best way?
So the website for Genesis is GENESIS.Roseman.edu. Roseman, ROSEMAN.edu. I shared the website about the platform that we have, hmbl.health.com. And so and then I'm on all the other platforms, right? So Luther Brewster on LinkedIn, Bundle BNDL2 on Instagram, and so we and then I can be old-fashioned too. You can just send me an email. I'm a very open person, and you can reach me at lbrewster@roseman.edu with any questions and anything that can be supportive of what we're doing. If there's medical students out there who are looking for a better way, or future medical students who are looking to enter around 2024, send me an email. Let's talk now. Let's figure out how we can work together to build something revolutionary out here.
Fantastic. Thank you so much. This has been great talking with you.
It's been a pleasure. I'm so happy I got to meet you finally. And so let's now I got you on the record. Yeah. Once a year we check in Roseman's growth.
Absolutely.
All right. Good deal. Take care now.